Hello and good evening, everyone. You are welcome to the first lecture on epidemiology. We will be taking some few lectures, and after the lectures, we'll have a mock MCQ exams as well as picture test. And secondly, your assignments on epidemiology will be uploaded so that you also have opportunity to browse through the topic and see important areas that are relevant that you may be asked in your exams. So today we are going to talk briefly on some important aspect of epidemiology, and if time permits, we'll answer some multiple choice questions that will follow. So epidemiology is a branch of medicine that deals with the incidence, distribution, and possible control of diseases and other factors relating to health. Now, by a standard definition given by Last in 1988, he defines epidemiology as the study of the distribution, determinants of health-related states or events in specific population, and the application of this study to the prevention and control of health problems. So this is a comprehensive definition on epidemiology, but the most important thing you should know is a study of the incidence, distribution, and control of disease and other health-related problems. Now, in studying epidemiology, you should understand the epidemiological triad that is consist of three factors: the agent, the host, and the environment. This is called an epidemiological triad or a triangle. For a disease to occur or spread, it requires one of the following factor. If there is missing, if any of this factor is missing as a triad, the disease does not spread. Okay? Now, the triad is one of the traditional models for depicting disease causation. The triad is used to determine the cause of infectious disease, non-infectious disease, and accidents or injury. Now, you should know, for the purpose of multiple choice question, for example, this triad is not limited to only disease transmission. Other factors, including even accidents, will feature here because, of course, there is an agent, host, and environment. So you should know, if you are asked the epidemiological triad, it's a triad that only depicts the transmission of infectious disease. That is not correct. It can also be applied to non-infectious diseases, as well as even accidents and injuries. It is considered the interaction between external agents, susceptible hosts, and the environment. Okay. Now, aside this epidemiological, let's take an example. If you have malaria, for example, you have the host, the agent, and the environment. The host is the affected individual. The agent is Plasmodium. You need a medium environment which the Plasmodium will breed. Okay? You need a medium for the Plasmodium to breed. So an environment where a mosquito will survive, okay, like stagnant water. So you need these three agents: the pathogen, the host, the susceptible host, as well as the environment. Even transmission of some certain diseases, you have an immunosuppressive host, okay, or a host might be based on the age of the patient. You have some diseases affecting maybe the elderly group or affecting the pediatric age group. So there must be a condition that will make um, a host susceptible. Okay. So, and you have an environment that makes a disease thrive. Now, you should also understand the concept of the iceberg phenomena in the manifestation of diseases. Now, if you remember, an iceberg, what is beneath the sea, the water level is bigger than what you see visible. You say the tip of an iceberg because what is submerged within the water is bigger than what you can see apparently. So this iceberg phenomenon is applied to diseases that have a wide range of spectrum from um, asymptomatic, subclinical manifestation, clinical manifestation, up to the severe form of that disease and death. Now, a common situation in clinical practice where only small proportion of cases of important disease are seen. So that the small proportion that is seen is described as the tip of an iceberg. And this is at the early stage in the natural history when intervention can achieve prevention, cure, or relief of symptoms. Now, what this concept is describing, at the early phase in the natural history of the disease, when you start seeing manifestation of such disease, okay, when you see few manifestation, what is present at that period that is subclinical is massive. When you start seeing manifestation of diseases, okay, if you see few cases, it means the cases that are in the spectrum of the subclinical, okay, phase or asymptomatic phase is massive, is very huge. And it is at this point you can target prevention of that massive submerged phase or the subclinical phase before they move into the visible cases. Okay, so any epidemiologist targets the subclinical manifestation. If you see somebody who commits suicide, it means in that environment there is a risk factors. There are many more that are affected by that risk factor. If you do a survey, you will see many more individuals who are predisposed to that risk factor. Okay? And then you go ahead in instituting preventive measures. If you see a clinical case, you should know that what is in the subclinical or the submerged phase is massive. And an epidemiologist will target prevention in that phase. That is what the iceberg phenomena is all about. The size of the submerged portion decreases with improved screening method. If you have a very good screening tool, you tend to pick out all those that are affected, and it tends to progressively reduce those in this phase. This is just a typical example of a disease, Jones disease, in the iceberg phenomena. Describe a situation in which a large percentage of a problem is subclinical, unreported, or otherwise hidden from view. Thus, only the tip of the iceberg is apparent to the epidemiologist. Uncovering disease that might otherwise be below sea level by screening and early detection after often allows for better disease control. Now, we shall talk a little bit about disease outbreak, and you should know disease outbreak is very important in your exams. Being in the multiple choice question, in your picture test, as well as in the OSCE. Now, you should know an outbreak is an epidemic. An epidemic is defined as a sudden outbreak of disease which spreads rapidly to a large number of people in a given population over a short period of time in a given region. Now, you should take note of some certain keywords here. You should know that in epidemic, there is sudden outbreak of disease and it spreads rapidly to a large number of people. Don't forget, in a given population. And because it's rapid, that's why it occurs over a short period of time. Okay? So epidemic is a sudden outbreak of a disease which spreads rapidly to a large number of people in a given population over a short period of time in a given region. Examples of diseases that can manifest in an epidemic form include measles, Lassa fever, yellow fever, cholera, Ebola virus disease, and several other diseases. So you should pay attention to these definitions. Now, there are various types of epidemic. You should know epidemic will be point source, common source, propagated, mixed, cyclical, pandemic, endemic, progressive, and non-propagated. Now, with regards to these various types of epidemic as related to your exams, you might be given a scenario. And amongst the questions that will come out in that scenario will be what type of epidemic is this. So you need to understand the various types of epidemic to be able to answer that question correctly. Okay? Now, point source, we are going to take each of these individually so that you understand what they mean. Now, when you talk about point source and common source, candidates often confuse these two, but you should know that the difference between these two in point source epidemic, the outbreak can be traced back to a single source, okay, of contamination. That is the first point you should know. The number of cases tend to increase rapidly and then decrease once the source of contamination is identified and eliminated. Okay? The source could be contaminated food, water, or a single individual. It is limited to a specific time or place. Example, an outbreak of gastroenteritis traced to a contaminated food in a restaurant. Okay, if you notice, there is a source in a restaurant, or it might be a feast you attend, or a party or something, and one of the food that was served in that party is contaminated. And all the individuals that maybe ingested such contaminated food came up with gastroenteritis, okay? And present maybe to the hospital or somewhere, and you do tracing, you found out that all those people involved attended such party or feast, and the cause is traced to that single source. If it's an ongoing incident, if you remove the source, all those that are not exposed to that contaminated food will not be exposed. Now, you should know it is limited to a specific time when an event occurs and a specific place where an event occurs. Now, you should be able to differentiate point source epidemic from common source epidemic. If you know, one of the differentiating factor is these occur rapidly. There is rapid rise, and when the source of contamination is removed, there is rapid decline. Now, coming to common source epidemic, there is exposure to a common source of contamination, such as food or water. This is similar to point source because here there is exposure to a common source. However, the exposure occurs over a period of time if you compare to point source, where it's something that occurs rapidly, and when you remove the source, it decreases rapidly also. But in common source, even though the exposure is from a common source, it occurs over a period of time. The number of cases tend to increase slowly and steadily, unlike until what? The source is identified and eliminated. Not limited to specific time or place. A large number of people is affected. Maybe a source of water supplying a district is contaminated. The entire district maybe will be affected from a particular problem resulting from that contamination. Now, this is something that will occur slowly over time because not at the same time everybody will ingest that contamination, so it will be increasing steadily and gradually until the source may be identified. A large number of people are affected. So these are the few differences between point source and common source. Usually, they give a scenario where you will see people attending a feast or something, and you are asked what type of epidemic is that. Now, it could be a propagated epidemic, the transmission from person to person. And this can be through direct or indirect contact. When a pathogen is transmitted from a person to another, maybe via droplets, someone coughs and the droplet from the cough is inhaled by another person and is affected by whatsoever disease that is in that droplet. That is a direct transmission. An indirect contact, maybe the droplets are on a surface and the second person touches that surface, and subsequently he applied the contaminated hands to his face or picking his nose, and that infectious agent is transmitted. You can see that is indirect. The infection was initially on a surface and it is picked by the second person. Now, in propagated epidemic, initially it starts in small number and then it later spread to involve large number of people. The number of cases tends to increase slowly at first, but then it would accelerate as the disease spread from person to person. So this is a propagated epidemic. Now, you should be able to note that in mixed epidemic is a common source and propagated epidemic. Now, cyclical epidemic occurs periodically in a population. Intervals range from few months to few years. And at those periods, there are conditions that are favorable for manifestation of such epidemic. It's often associated with infectious disease that have seasonal pattern. For example, influenza. It occurs in specific time of the year when conditions are favorable for transmission. Now, when you talk of endemic, now any disease that is present at approximately constant level within a given geographical location is described as an endemic disease in that location. For example, Nigeria, malaria is approximately constant amongst the population. So it's an endemic disease in our environment, okay? So you have malaria, typhoid, tuberculosis, HIV, gonorrhea, schistosomiasis. These are examples of diseases that are endemic in Nigeria. And the most common, of course, is malaria. Malaria, almost every individual living in our environment may have some degree of parasites in the body. So malaria is an endemic disease in our environment. Still on endemicity, the term hyperendemic, holoendemic, and exotic diseases are described. When you say hyperendemic disease, it expresses that the disease is constantly present at high incidence and or prevalence rate and affect all ages equally, okay? Now you should know that generally endemic disease are constantly present in a geographical location. When you say that is hyperendemic, the presence of that disease is of what? High incidence or prevalence. And secondly, it affects all ages equally. When you talk of holoendemic, it expresses a level of infection beginning early in life and affecting most of child population, leading to a state of equilibrium such that adult populations show evidence of disease much less commonly than the children, okay? Now, malaria is commoner, of course, in children, especially the under 5, as they go, that incidence tends to reduce gradually as the child grows until he gets to an age where it equilibrates between children and adults. And eventually you find the incidence of malaria is less common in the adult population than in the pediatric population. So you describe such disease as having holoendemicity. Now, exotic diseases are those which are imported into countries in which they do not otherwise occur. For example, when you find malaria in the UK, because malaria does not occur there, you describe that malaria as an exotic disease in the UK. Now, when you talk of pandemic over an extensive period over time, okay, the disease may have slow onset and a long incubation period and may be difficult to control. Now, this applies to chronic non-communicable diseases like hypertension, diabetes mellitus, and so on. Okay, you should know that these may be driven by lifestyle of an individual. So that is regarding progressive epidemic, and it is difficult to control. Now, sporadic diseases are diseases that occur randomly amongst the population. Now, the cases are irregular, they have hazard from time to time and generally infrequent. Okay. Now, cases are few and separated widely in time and place. Okay, that they show no or little connection with each other, nor a recognizable common source of infection. Okay. Example, sporadic cases of tetanus. Now, in sporadic cases, they occur randomly in a society, in a given geographical location, and they are not connected to each other. However, a sporadic disease could be the starting point of an epidemic when the conditions are favorable for it to spread. Okay? Even though you know sporadic diseases are not related to each other, but in a favorable condition, they may be a starting point for an epidemic. Now, eradication, elimination are often confused among candidates, but you should know that when you talk about eradication, it's a complete extermination of a disease from its existence. That is eradication. And when you talk about elimination, it is an eradication of a disease from a given geographical location. So, termination of all transmission of infection by extermination of the infectious agent through what? Surveillance and containment. That is eradication. And you should know that eradication is an absolute process, an all or none phenomenon. Okay? Restricted to termination of infection from the world. So it's completely related to wiping out of a disease, while termination is sometimes used to describe eradication of disease from a large geographical region. Diseases which are amenable to elimination in the meantime are polio, measles, and diphtheria. Now, isolation is fairly common because of cases of COVID-19. You should know that for isolation, okay, the separation for a period of communicability of an infected person or animal to prevent the spread of the infectious disease. Now, you should know in isolation, it is the infected individual that is separated. You know the incubation, you know the, what do you call it, the period of transmission of that organism. So that isolation period will be the period for which it's expected that that disease is transmitted. It can be in a hospital or at home. For example, You isolate patients from chickenpox, cholera, COVID-19, and so on. While quarantine is a limitation of freedom of movement of a well individual or people. Now, in isolation, the individuals are what? Infected. While in quarantine, the individuals are not infected, but exposed to what? Infected. Now, what you do in quarantine is to keep an individual for a period of time, not longer than the incubation period of that disease. If that individual is infected because of exposure, okay, during that, after the incubation period, he will manifest with symptoms of the disease, okay? If there is no if there is no infection, the quarantine individual will not have manifestation. So it's limitation of freedom of movement of wild people or domestic animal exposed to a communicable disease for a period of time not greater than the incubation period of that disease. Now, we are going to talk about epidemiological study types. Now, broadly, you should know that epidemiology are broadly classified into experimental and observational, okay? Experimental and observational epidemiology. For observational is further classified as either descriptive or analytic. Of course, in experimental, when conducting experiments, you have control on who to recruit and not to recruit into the experiment. So you have control over the outcome. While observational, you don't have control over the outcome of that study. So, okay. Now, when you talk about observational, as we said, it could be descriptive or analytic. Now, in descriptive observational study, you describe time, okay, place, and person. It deals with the distribution of time, place, and person involved in a study. While observational, analytic, compare risk affecting individuals and you observe the outcome by comparing two. You can see you have no influence on the outcome. Maybe you subject A and B to a certain risk factor and see the outcome of that your analysis. So it's an observational study, okay? Descriptive being also an observational study, you observe and describe time of an incident, place where it occurred, and the people or the person that is affected. So you can see you don't have influence on the outcome of observational study. While experimental, you can decide to include some certain groups into your experiment and exclude some certain group from your experiment. In an experimental study, the investigator can control certain factors within the study from the beginning. An example of this type is a vaccine efficacy trial that might be conducted by the National Institute of Health. In such trial, the investigator randomly control who received the test vaccine and who does not among a limited group of participants. Okay, they then observe the outcome to determine if it should be used more widely. An observational study, the epidemiologist does not control the circumstances. These studies can be further subdivided into descriptive and analytic. Descriptive epidemiology is the more basic of these categories and is fundamental to what epidemiologists do. In the descriptive study, the epidemiologists collect information that characterize and summarize the health event and problem, okay? So it just collects and characterize and summarize. In analytic study, the epidemiologist relies on comparison between different groups to determine the role of different causative conditions. Just observe the outcome. This table further differentiates descriptive from analytic epidemiology. For descriptive, when was the population occur? Okay. Population affected, time. Where was population affected? Place. Who was affected? Person. So you are describing when, place, and person. While in analytic, usually, how was the population affected? Why was the population affected? Okay? Time, place, and person is the mantra of the epidemiologist. Another way of comparing descriptive and analytic epidemiology is to say that during the descriptive process, we are concerned with when the population was affected, where they were affected, and who specifically was affected. Okay? From the observations gathered during the descriptive process, a hypothesis is generated about the cause of observed pattern and the factor that increase risk or injury. Now, to test a hypothesis, epidemiologists must use an analytic epidemiology process, okay, in which they ask how and why a population is affected. Now, in conducting a study, studies are conducted in an attempt to discover associations between an exposure or a risk factor and a healthy outcome. Now, so if you are to conduct a study, you need a design. What are the various epidemiological study design? You could have a cross-sectional study, and in cross-sectional study, subjects are selected because they are members of a certain population subset at a certain time. Okay, maybe you want to do a cross-sectional study of obese individuals in the elderly group. You can see at that particular time, you are just taking a cross-section of obese individual at a subset, okay? And over that period of time, you look at it as a snapshot of a group of individual at a particular time. You are taking a cross-section or a snapshot of a particular subset of individuals. So that is a cross-sectional study. While a cohort study, subjects are categorized based on their exposure to one or more risk factors. Okay? If you have a group of smokers, okay, amongst maybe university students. You can see those group of smokers are categories. So you have, they are described as what? Cohorts. They are all those categories. The university students are exposed to what? A particular risk, which is what? Smoking. You have a cohort of university students that are exposed to a particular type of risk factor. So that is a cohort study. Now, in case control study, subjects identified as having a disease or condition are compared with subjects without the same disease or condition. So what are you doing here? A disease and without the disease. Okay, then you now compare to see the outcome. That is a case control study. Now, it is also important you know how to investigate an outbreak. Investigation of an outbreak, I could remember in one of the exams you did, this came out in an OSCE station that you should outline the steps of investigating an outbreak. Now, you should know, as an epidemiologist, if you are to investigate outbreak of a disease, number one, you must establish the existence of an outbreak, okay? If there is a news of an outbreak in a given geographical location, number one, you must establish that, yes, there is existence of that outbreak. Okay, you have to confirm the genuinity of an outbreak. It really exists. And of course, when there's an outbreak in a given geographical location, you don't just go and enter that. You have to make what? Preparation. Okay, you have to prepare for field work. Okay, and when you prepare and get to the field work, you get to the field, you have to verify the diagnosis. You have to get an affected individual, evaluate that individual, and confirm that, yes, this is actually affected by the outbreak that is being claimed. Okay? Next is defining and identifying cases. You want to get your population of the study or the affected individual. Okay, you want to see, okay, in these particular regions, how many houses are there? In those houses, how many people are affected? You have confirmed the diagnosis that certain thing is going on in a given geographical location. You want to now start identifying those that are affected, okay? So you now get your cases. Now, if you remember, we say before you do any analysis, you can give a description of what is happening. You give a descriptive epidemiology, okay? It tells you that, okay, you have gone to a certain time, at a certain place, some certain persons were affected by cholera. So you are giving a descriptive epidemiology. Then you now develop a hypothesis. Of course, well, these first five are easy to remember. You establish existence of that outbreak. You prepare before you go to the field. And when you get to the field, you get affected, verify the diagnosis, then you now identify all others that are involved. Then you now describe the epidemiology. You give a descriptive epidemiology, the time the outbreak occurs, the place it occurs, and the people that were affected. Afterwards, you now develop your hypothesis, okay? Now, you now evaluate the hypothesis you develop, okay? You evaluate it. So development of hypothesis, evaluation of hypothesis, refining your hypothesis. Okay, after you refine your hypothesis, you now start implementing. The entire aim of investigating the outbreak is to start implementing your what? Control and preventing measures in that environment. And subsequently, you communicate the findings, okay, of your investigation. So these are 10 steps involved in outbreak investigations. Okay, you should take them seriously because they have been asked before and they might resurface. Now you can see outbreak investigation. We talked about step 1 and 2, establishing the existence of an outbreak, use data from data source, okay? Preparing for field work, okay? You have to research the disease, gather supply and equipment, and arrange travel. And when you get there, you verify the diagnosis, speak to patient, review laboratory finding and clinical test results. Then 4, defining and identifying cases, establishing a case definition by using standard set criteria and using descriptive epidemiology, describe and orient the data. Now, we shall talk about some measures you use in evaluating epidemiology. When you talk about incidence, when you say incidence, is the number of new cases that develop over a certain period of time. When you have a disease in a geographical location, when you emphasize on only new cases, you are talking about what? The incidence of that disease in the environment. Incidence of disease in an environment is the number of new cases that develop over a certain period of time, okay? And calculating the incidence rates of a disease is the number of new cases of a disease occurring in the population during a specific period of time divided by the number of persons who are at risk of developing the disease during that period of time. Now, what is prevalence? Prevalence is the proportion of a population who have a specific characteristic in a given period of time. Now, it talks about all the people who are affected, the number of existing cases, including old and new cases that have developed at some point during that period. So don't forget, incidence deals with only new cases in an environment, while prevalence deals with both the old and new cases. And you should know there are various types of prevalence. There could be a point prevalence, the proportion of the population that has the characteristic at a specific point in time, while period prevalence is the proportion of the population that has the characteristic at any point during a given period of interest. Past 12 months is a commonly used period. If you want to know how many of these people have such disease over the last 12 months, that is period prevalence. While you talk about lifetime prevalence, is the proportion of a population who at some point in lifetime has ever had such characteristics. And to calculate the prevalence rate, the number of cases of a disease present in the population at a specific time divided by the number of persons in the population at that specified time times 100. Okay, new cases incidence. Prevalence is new cases including old cases. And the prevalence, you have several outcomes. Some patient could recover, some might end up becoming carrier, there might be reemergence of disease, or you could have death. So we've come to the end of the first part of our lecture on epidemiology. If you have any question, you ask, because in the next 30 minutes, if you in the next 30 minutes, we are going to answer MCQs. So if you have questions, we have 5 minutes to ask questions. Any question, you can unmute yourself and ask. Okay, it appears all of you are sleeping. Jamilu Ibrahim Ahmed, last time you were just sleeping. Where's Jamilu?
Yes, doctor.
Okay.
Good evening.
Wow. Okay, so since there is no question, without wasting much time, we are going to proceed with the MC. If you have a noisy background, please don't put on your mics. If you have a noisy background, you only answer when you are asked. Okay? So let's answer some of the questions. Which of the following is the study of distribution of a disease in the population? Okay. A, posology, B, pathology, C, epidemiology, D, descriptive statistics. Yes? Who is answering quickly so that we can go on?
C.
C, epidemiology, correct. The occurrence of cases of illness in a community that are above the normal expectancy for that community and at a particular time is A, epidemiology, B, endemic, C, epidemic, D, none of the above. Yes?
Epidemic.
None of the above.
One says none of the above, one says epidemic. What is the correct answer? Above normal.
Epidemic.
Epidemic, yes. Which of the following epidemics are usually of slow progression? A, congestive heart failure. B, asthma. C, all of the above. D, none of the above.
C.
C, all of the above. And what type of epidemic is that? What type of epidemics? Among the various types of epidemic we describe, what type is that? Okay, you've forgotten all already. It's described as progressive epidemic. I said progressive epidemic is used to describe chronic non-communicable diseases. An epidemic caused by food poisoning from a feast is likely A, common source epidemic, B, a propagated epidemic, C, a progressive epidemic, D, none of the above.
D. Common source.
No.
None of the
None of
above.
the above.
None of the above. Yes. Because this is what?
Source.
Point source.
Point source.
Excellent. Why is it point source?
That is feast.
Why is it point?
Because disease can be traced to a particular source.
Yes, that is a point. And it occur at a particular time and place. Okay? A feast occur, it can be traced. It occur at a particular time, at a particular place. It occurs rapidly. And when it is removed, it rapidly declines. It affects groups of people not as large as common source. Yes, the transmission of an infectious agent from one person to another result in what type of epidemic? A, common source. B, propagated. C, non-progressive. D, none of the above.
B.
B. Propagated.
Propagated.
Correct. The type of epidemic caused by a mosquito is A, progressive. B, non-propagated. C, common source. D, none of the above. Yes, the class is quiet. Hello? Am I alone?
Yeah, with you, sir.
Okay, what is the answer? Malaria in our environment. No answer. I told you that malaria in our environment is endemic. Have you forgotten?
None of the above.
Present. So here is none of them.
None of the above, sir.
Yes. Okay. Verifying a diagnosis is the second step in epidemic investigation. True or false?
False.
What is the second step?
Preparing for a field work.
Excellent. Excellent. So this is false. Okay. Epidemiological investigations must be delayed until laboratory results are ready.
False.
False, sir.
False. Why is it false?
Can be carried out without laboratory results.
Why? Why mustn't it be delayed? You are dealing with epidemic that spreads now. Your entire aim is to achieve what? Control and prevention. And if you are waiting for laboratory results to diagnose such, it might have spread and gotten out of hand. To confirm the existence of an epidemic is a part of preliminary analysis. All the preliminary analysis involve all the steps you take before creating a hypothesis. So you have to even confirm the existence that an epidemic occur. You have to search your database, confirm, yes, there is this epidemic even exists. Okay, then you now prepare for your field work. You now go there and verify the diagnosis. Then you now get your cases. Then you now make your descriptive epidemiology. Okay, it is after your descriptive epidemiology, you now state a hypothesis. You now reevaluate your hypothesis, you refine the hypothesis, okay? And of course, you want to implement control and preventive measures, you now communicate your finding. But so you should know in the beginning, you have to confirm the existence of an epidemic. An epidemic curve is a graph plotted against time of onset, a graph of cases plotted against location, all of the above, none of the above. Yes, are we together? Hello?
A.
Where is
Yes,
our...
cases against time of onset.
A curve that is plotted against where and where? A graph plotted cases against the location, cases and where they occur. Is it A or B?
A. Right?
Yeah.
B, sir. B, sir. B, sir.
A or
B.
B?
B for boys, sir.
A.
A.
So what does the epidemiological curve does? It shows you when it occurs and its maximum peak before it declines. So A is the correct answer. A spot map is one that deals with location, but epidemiological curve is the one that deals with time, okay, against onset. A spot map, a graph of cases plotted against location. This one is correct. This is wrong, it's for the previous one. Okay, then which of the below increases the prevalence in epidemiology? We said prevalence is what? Both the new and old cases in a given population. So what is our answer here? What will increase prevalence?
C.
Yes, C is correct. Which of the below decreases prevalence?
None of the above.
D.
None of the above.
None of the above. None of the above.
Okay, emigration of healthy people from a particular region may cause prevalence to do what? Increase or reduce? Emigration, they are moving out. Healthy people are moving out.
Decrease. B.
You live sick here and healthy are moving out. What will happen to the prevalence? What is our answer?
B.
Are we together?
Yes, sir.
What is our answer?
B. It will decrease.
Really? Emigration of healthy people from a particular region may cause prevalence to what? Increase, decrease, all of the above. Which one?
Decrease.
Increase.
It's going to increase now. You are leaving only sick people in the region. Healthy people are leaving. What will happen to prevalence? It will increase. Immigration of healthy people into a particular region may cause prevalence to do what?
Decreased.
A, increase.
B.
B, decrease. Okay. Yeah. Because you remember, if you are calculating prevalence, is dividing by the total number of people. So if new people are coming, the incidence, the prevalence will be reducing. Underreporting of new cases may cause A, decreased prevalence, increased prevalence, no effect on prevalence, all of the above. Yes? What is our answer?
Increased prevalence.
The ladies are not
A.
participating. Underreporting of new cases will cause what?
Decreased
Decrease
prevalence.
Okay.
A, sir.
Since you are not participating, when we get to number 20, we will stop. Prevalence can be decreased by the following except A, improved cure rate, shorter duration of disease, longer duration of disease, underreporting of new cases.
Longer duration of disease.
Prevalence can be decreased by the following except, what is your answer?
C.
Yes, correct. Point prevalence is the most common measure of prevalence, true or false?
True.
True, yes. Which of the below is true about period prevalence? A, requires stable population. It is the most common measure of prevalence. All of the above, none of the above. Yes? A, yes, because you are calculating over time, over a period of 12 months. If the population is not stable, you will not get. Now, the existing cases of a healthy condition at a particular point in time is a measure of A, incidence, prevalence, instance, none of the above.
Prevalence.
Prevalence.
Yes.
Which is true about prevalence? Is a product of incidence and duration. Is a product of incidence and duration after steady state is reached. Is a sum of incidence and duration, none of the above.
B.
Yes. The definition of epidemiology entails all except
Determinants.
All correct.
the
Determinants.
definition of epidemiology entails all except what?
There's no determinant in the definition.
Are you sure?
So the answer should be none of the above, but there's no option.
There is no answer here. You see why sometimes you cannot get 100%. Who is the father of epidemiology?
Jon Snow.
Jon Snow.
Why do you say so?
Jon Snow, sir.
Hippocrates is father of what?
Medicine.
Yes. What did Jon Snow do? Okay. Which of the type of epidemiology quantifies the burden of a disease and seeks to explain its pattern of occurrence? A, analytic, descriptive, all of the above, none of the above.
Descriptive.
Descriptive. Which of the type of epidemiology deals with variables like person, place, and time?
Descriptive.
Descriptive.
Descriptive. Which of the type of epidemiology deals with comparison of groups?
Analytic.
Analytic. Which of the epidemiology types below is concerned with why and how?
Theology.
Analytic.
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 In an analytic epidemiology where the investigator does not control the exposure between group under study is called
Observational study.
yes?
Observational study.
Observational study.
No. True or false? Yes, correct. Observational, they do not control. Which one do they control?
Experimental.
Experimental, correct. In an analytic epidemiology where the investigator controls the exposure between groups under study is called
Experimental.
experimental. Which of the study design below is best for groups or population?
Cross-sectional.
Cross-sectional, correct. A collection of individual case reports occurring within a fairly short period of time is A, case report, case design, case series, this case description.
Case series.
Case series. Okay, case report is used for describing rare conditions. You want to report a case that is not common. When you have such of cases, you call them case series. Which of these design below is both descriptive as well as analytic?
Cross-sectional.
Cross-sectional. Concerning risks, we've not discussed this. Okay, let's stop here. Tomorrow we'll continue. It's 10. So thank you very much, everyone, for participating. The slide will be shared on the group. Thank you all.
Thank you,
Hello,
sir.
sir. Please,
Thank
sir.
you, sir.
You're welcome.
Excuse me, sir.